Dislocation. A dislocation happens when the new ball slips out of the socket. You'll receive guidance on positions and movements to avoid early on after your surgery. This is most common in the first few months while the soft tissues are healing. If this occurs, you would need hospital treatment to put the hip back into place. Repeat dislocations may require further surgery. Wear or loosening of the implant. All artificial joints gradually wear over time. In some people, the components loosen earlier than expected. If this occurs, it may cause pain or instability of your total hip replacement. You might need further surgery to replace the worn parts. This is revision surgery. Ongoing pain or stiffness. Most patients feel much better after surgery, but a small number continue to have discomfort or stiffness. If this occurs, physiotherapy, medication, or further investigations may be needed. Sometimes the cause can be identified and treated. Other times, symptoms may persist. Nerve damage. Nerves near the hip can be stretched, bruised, or injured during surgery. If this occurs, you may notice numbness, tingling, or weakness. Injury to certain nerves can lead to foot drop, where lifting the foot becomes difficult, or cause persistent numbness in the foot or ankle. These symptoms often improve over time, but can occasionally be permanent. Leg length difference. Although the aim is to keep both legs the same length, small differences can occur, sometimes intentionally to improve stability of your hip. If this occurs, most differences improve over time. A shoe insert can sometimes help. Rarely, significant differences may require further intervention. Fracture. The bone can occasionally crack or break during the operation or later after a fall. If this occurs, additional fixation with screws or plates may be needed. Sometimes a different implant or further surgery is also required. Blood vessel injury. There is a small risk of damage to nearby blood vessels, which can cause bleeding. If this occurs, the bleeding may need to be controlled during surgery. Occasionally, repair by a vascular surgeon or a blood transfusion may be required. In extremely rare circumstances, severe bleeding can lead to a fatal complication. putting the risks into perspective. Some of these risks, particularly blood clots, heart attacks, strokes, and severe bleeding, can very rarely be fatal complications. However, it's important to emphasize that these outcomes are extremely uncommon. The vast majority of people recover well and experience major improvements in pain and mobility. We take every possible precaution to keep all risks, both minor and serious, as low as we can. Understanding the potential risks allows you to make a fully informed decision about whether this surgery feels right for you.